is to provide universal access to quality, affordable health care. Here's another issue with Obamacare. Obamacare is not just the individual market that you think of the Obamacare subsidies. It was also a taking over of the Medicaid program. Here's the problem with Medicaid. Medicaid is a program that is Washington controlled, and it is done in such a way that it stops innovation and experimentation at the state level. It makes it harder for states to customize the Medicaid population and the Medicaid program to work for their particular states. And as a result, more and more doctors just don't take Medicaid. I mean, what good is your coverage if you can't get a doctor? And that is a huge growing problem with Medicaid. Medicaid is also growing at an unsustainable rate, so its ballooning costs are threatening the very viability of the program and our fiscal future. So what we propose is to modernize the Medicaid program. Modernize the Medicaid program along the lines that we as Republicans have been talking about for years. I think it was Ronald Reagan in like the 70s when he was governor who said the states should take over control of Medicaid. Every budget we have had as Republicans, when I was budget chair writing my roadmaps or the path to prosperity, every one of our Republican conservative budgets said, let's get Medicaid control back to the states. In an honor to the principle of federalism, give the states and the governors the freedom and the flexibility to customize the care for their low-income populations how they think needs to occur. Our problems in Wisconsin are a whole lot different than the problems they have in New York or in Nevada or in Utah or California. So we propose more efficient spending, bring the spending on Medicaid to something that is sustainable so it doesn't go bankrupt, and have a safety net for the most vulnerable. Give local control to our states and our governors so that they can craft and customize Medicaid to work for their populations. How do you protect people with pre-existing conditions? I think this is probably one of the most important issues of them all. Here is basically what happens today. Under the current system, we have costs driving up. On the current system, options are going away, as I just described. Choices are fleeting, prices are going up, and under the current system, the fatal conceit of Obamacare is that we're just going to make everybody buy our health insurance at the federal government level. Young and healthy people are going to go into the market and pay for the older, sicker people. So the young, healthy person is going to be made to buy health care, and they're going to pay for the person, who gets breast cancer in her 40s or who gets heart disease in his 50s. So take a look at this chart. The red slice here are what I would call people with pre-existing conditions, people who have real health care problems. The blue is the rest of the people in the individual market. That's the market where people don't get health insurance at their jobs, or they buy it themselves. The whole idea of Obamacare is the people on the blue side pay for the people on the red side. The people who are healthy pay for the people who are sick. It's not working, and that's why it's in a death spiral. Here's how we propose to tackle this problem. We want to have a system where we encourage states with federal funding to set up risk pools and reinsurance mechanisms. So, for example, in Wisconsin, we had a great risk pool that actually worked so that people with real high health care costs and diseases and pre-existing conditions could still get affordable health care. Well, Obamacare repealed that. They had a great risk pool reinsurance system in Utah, a good one in Washington State. All those are gone under Obamacare. Here's how they work, and here's how our system would work. We would directly support the people with pre-existing conditions. Let me give you a sense of this. 1% of the people in these markets drive 23% of the costs. 1% of the people in the individual health insurance market drive 23% of the costs. So a reassurance program is to cover more than just the 1%, to cover the people who have high health care costs. So by having state innovation funds to go to the states to set up these reinsurance programs, we would directly subsidize the people who have pre-existing conditions. Direct support for the people with pre-existing conditions so that everybody else has cheaper health insurance. What you do when you do this is the individual market, the people who don't have pre-existing conditions, they have much more stable prices. Let me give you an example. Take a small business that has 40 employees. Let's say that 4 people in that business get cancer. Well, under that business has to pay for all those cancer patients, all those cancer treatments. So the other 36 people in that 40-person pool get hit with much, much higher premiums to pay for the 4 that got cancer. That's how insurance works today. And that is one of the reasons why this thing is going bankrupt. Here's our solution. Let's make sure we just cover the people who have pre-existing conditions. Make sure that reinsurance or risk pools kick in for those 4 people in that small business that get cancer, subsidize that coverage, and what you do by doing that is you dramatically lower and stabilize the price of insurance for everybody else. So those other 36 people in that small business have predictable prices, lower prices. That brings you more choice, more competition, and lower prices for the vast, vast majority of Americans who are not in the pre-existing condition category. So directly subsidize them through state-based risk and reinsurance pool programs that we would finance with support from the federal government to attack this problem and let health insurance stabilize, go down in price. Here's another